Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. On today's episode, we're sharing a conversation that was originally recorded for our sister podcast, MIMS Learning's Clinical Update. In this episode, MIMS Learning Deputy Editor Rhiannon Ashman speaks with Dr Michael Blackmore, a GP partner, chair of the RCGP's West Scotland Faculty and a recovering addict, about the critical yet often hidden issue of addiction and recovery within the medical profession. In this candid and powerful conversation, Michael shares his personal journey of struggling with addiction while practicing medicine, his path to recovery with support from services like NHS Practitioner Health, and how his lived experience now shapes his clinical work. He also offers insightful advice on spotting unhealthy coping mechanisms, breaking down stigma, and where healthcare professionals can turn for help. This is a really fantastic interview about an important and often overlooked issue within the medical profession, and Michael is really inspiring, so I'm really pleased that we were able to share this with a wider audience. Just a warning before we start, this conversation includes discussion of suicide as well as addiction and drug use.
I'm Rhiannon Ashman, Deputy Editor of MIMS Learning, and I'm really pleased to have Dr Michael Blackmore with me today to talk about addiction and recovery, specifically looking at how this can affect medical professionals. Michael is a GP partner, RCGP Chair of West Scotland Faculty, and is himself a recovering addict. Welcome to the podcast, Michael. I really appreciate you being here.
Thank you for asking me.
So on this podcast, regular listeners will know, we often focus on tips to provide the best clinical care for your patients, but as the saying goes, you can't pour from an empty cup. And with recent changes to GP appraisals, placing greater focus on healthcare professionals' well-being and compassion and respect for colleagues, I thought it was important to cover this topic. So although we're much more aware of the risks of burnout and stress among people in the profession these days, addiction seems to me to be a bit of a problem that's hiding in plain sight. And that's also why I'm so grateful to have come across Michael, who I know you've been so generous in sharing your own experiences with colleagues over the years, and you're going to talk to us today. So Michael, as I said in the intro, you've been very open about sharing your own experiences with addiction. And I think that for many clinicians, there's a sense of it's not going to happen to me because of their training. So do you have any idea of the sorts of numbers, percentages that are affected in the profession?
I think the numbers quoted by Claire Gerarda from the Practitioner Health Programme is something like a 10 to 12% career risk throughout your career of using some sort of abnormal coping mechanism that can eventually trip you up if you don't do something about it or seek help.
Is there something about the kind of traits that are often found in healthcare professionals, like being very driven, maybe perfectionism, perhaps being a bit hard on yourselves, combined with the kind of work hard, play hard, medical school thing? Does that potentially put healthcare professionals at an increased risk of those coping mechanisms, like you said?
I think we can be very obsessive compulsive at times. And like you say, perfectionists, you kind of have to be to get into medical school. And then, you do work really, really hard. When I was doing medicine, I was quite jealous of the people who were doing arts degrees who weren't in as much as me. And yes, we partied hard. There were medic pub crawls. And then there is the uncertainty of medicine. I struggled with the analysis paralysis sometimes that comes with difficult cases. And it was a choice of, do I make this decision or this decision? And sometimes I struggled to make any decision, and that was probably worse for the patient. So I had to quieten down my monkey mind with some sort of pill, powder, or potion. I thought I'd found the magic way of navigating a medical career, but it turned out that ended up growing arms and legs and almost killing me. Abnormal coping mechanisms is something that medics more easily slip into because we have access to drugs, the keys to the sweetie cupboard.
Yeah. So if you're looking back at your early career, you're happy to share kind of how your relationship, I believe, was it alcohol and drugs that you were addicted to, how that kind of developed, and whether there was a point at which you realised that this has gone beyond the coping mechanisms that other people might be employing.
Okay, so it was difficult being the clever kid at school. I got bullied quite a lot. These adverse childhood events led to me being wired and fired and predisposed to abnormal coping mechanisms. When I discovered alcohol, it was a case of instant arsehole, just add alcohol. I was a liability. Then I moved on to other drugs like cannabis, and that quietened down my busy, over-analytical mind for a while. But then I would sort of use that way too much, and then it started causing problems. And I moved on to other drugs. I kept on moving the goalposts, making the abnormal normal. It would be ecstasy in the early 90s, speed, cocaine. And then that just kept on changing and developing. And I ended up using opioids and benzos, as well as copious amounts of antidepressants from my GP to try and help navigate life and my career. It was really difficult and scary at some points, and my tolerance kept on going up and up and up, and I needed more and more and different combinations to cope. I didn't realize I had a problem. I thought I had found a coping mechanism. I didn't realize that I was slowly killing myself. I kept on transferring issues onto other people, saying, I've got these problems, you need to help me, you need to give me something more and more and more. And since becoming a partner, I see a lot of that in my patients as well, that transference. There is no sign that you go past. There's no pink neon flashing sign that says you are entering addiction. You just, sort of slip into it. And I was sick and tired of feeling sick and tired, but I didn't know how to change anything. I tried psychologists for 90 quid an hour. I tried, like I say, various antidepressants. I tried all these sort of ways that people want to make things easier, but I didn't think about stopping everything. That just didn't seem to cross my mind. I was making the same mistakes over and over again, expecting a different result. I was using some sort of pill, powder, potion to try and feel better. And it's when I took all of those out of the equation that I started to get better. It's not a moral failing or a lack of willpower. It's a disease. I had the disease of dis-ease. I felt uncomfortable in my own skin. I had the disease of perception. The way I saw the world wasn't the way the world always is. The way I saw medicine isn't the way that always was. So I had to change the way I looked at the world.
And when you're describing that situation where you're using increasingly large amounts, you're still practicing medicine at this point. You described yourself as a functioning addict at one point, right? So how were you kind of managing that and the pressures of the job and the decisions?
Yeah. Okay, I'm not proud of it, but I was recycling opioids and benzos from work. Let's face it, I was stealing them because I needed more and more and more to cope with the pressures of the job. We've all heard about absenteeism. That's people not turning up to work on a Monday morning after a heavy weekend. But presenteeism is a big problem for medics. We keep on turning up at the coalface when we really shouldn't be there. I had a problem with that. I also had a problem with that because that's where I was getting my drugs of choice from. Drugs of choice, drugs of no choice. No one wants to recycle medications from work. But I saw no other way out of it. I didn't know how to function without those drugs inside me. I thought they normalized me. I didn't know of any other way of coping. But of course, I was a liability. I wasn't practicing medicine to the best of my ability. I was impaired, and it took a long while to realize that. And then when I did realize that, I can't do this anymore. That's when I sought help through the Sick Doctors Trust, British Doctors and Dentists Group, and the Practitioner Health Programme, which saved my life.
Will you tell us a bit more about that when you did seek help and what that looked like, kind of logistically, and how it worked out?
I was working in out of hours at the time because I wasn't good enough to be a daytime GP, definitely not good enough to be a partner. So I was seeing lots of patients with renal colic, and I was dispensing a lot of pethidine, but using a good proportion of that. And I realized I had this epiphany that I was going to die if I wasn't careful. I'd tried overdosing twice. I tried killing myself twice. I'd written the Goodbye Cruel World letters, but I'd messed it up. So I thought I had to do something different. So I asked for help. And I'd never really asked for help before. I was an arsehole. An arsehole is someone who asks for help but then doesn't follow through with it. And I did ask for help and didn't follow through with it. Lots of my patients are arseholes. But I did follow through with it this one time. I phoned the Sick Doctors Trust and I told them all my problems, all my woes. And then the person at the other end said, do you think drink and drugs might have something to do with this? And that was like, no, of course not. It's the pressure of the job. It's my childhood. It's my relationships. It's all this other stuff. It's not my abnormal coping mechanism. But of course, it was my abnormal coping mechanism that was causing many, many, many of the issues. So they told me to go along to the British Doctors and Dentists group. I went along and I heard someone there tell me my own story back. And it was such a relief. It's not just me. There are other people out there with the same career as I have who have done the same sort of stuff. And look at them. They're doing great. I want some of that. So then someone said, you have to get help. So why not refer yourself to the Practitioner Health Programme? And I did that. And I met Claire Gerarda, the ex-chair of RCGP, and she suggested I self-refer to the GMC. And there was no way I was going to self-refer to the GMC. Shut up, I'm not raising my head above the parapet. But I was close to killing myself, so you know what? I self-referred to the GMC. I started handing over some of my willpower and my decisions, and the GMC were really quite fair. They treated us as a health condition. They gave me all these conditions that stopped me from ending up killing myself. They told me to start being honest with employers and my own GP, and because of that, I ended up getting admitted to a rehab where I could start trying to let go of the doctor persona, be a bit of a patient, and take on some of the advice that was given to me. And going into rehab was probably the best thing I ever did. It was like pressing fast forward on my recovery, and I think they probably saved my life.
It's interesting you talk about sort of being the patient again, because I'm sure that's something that doctors find difficult to do, stepping out of the doctor role into the patient role, right?
Yes. When I first went in there, I was like diagnosing and judging everyone. You're a psychopath, you're a bampot, you're a slag. Hi, Hayden. But then I started sort of like looking at myself rather than other people. When I started looking at myself, I saw all these character defects that were what made me who I am. I was like, I don't want these character defects anymore. I want to try and change that. And once I had that insight, then I could do something differently. So at the very start, I could admit I was an addict. Hi, I'm Michael, I'm an addict. But I couldn't really accept it. It was difficult to accept. But once I accepted that when I put some sort of pill, powder, potion into my body, it set off that compulsion again. And it was like, oh, it's much easier not to use. I realized that my addiction was bigger than me, and I needed something bigger than that to beat it, because I couldn't do it myself. And that was people who'd been there, seen it, done it, and could show me how to do things differently. And some of these people, they weren't doctors. They were just your usual ex-IV drug abusers, and they were having amazing lives, and they taught me how to live life on life's terms, rather than the way I'd been trying to eke it all out and mess it up entirely.
So talking there about people that you sort of learnt from, people that helped you, were there any colleagues that helped you along the way? You mentioned Claire Gerarda just then. Was there anybody who was trying to say to you, hey, do you need to go and get some help? Here's where you can go. Or were you really sort of suffering in silence?
I did get challenged by the place I worked at for over-prescribing opiates. The controlled drug book had my name sort of 10 times compared to everyone else's once. But I said that was just because of my history working in A&E, and I wanted to make sure the patient was safe before they got transferred to another hospital for surgery, etc. And it was all just BS. I was just trying to cover my tracks. So they challenged me, and I said, you know what I'll do an audit. I'll sort of like audit my use and make a change, and then and I did that, and I just blagged my way out of it. No one really challenged me. So when I ended up crashing and burning, and I did say, I do have a problem, the first thing they did was sack me. So who else has helped over time? People who go to the British Doctors and Dentists group, I've heard their stories. I've been to various conferences, and I've met a lot of sick doctors, ill healthcare professionals along the way who've told me their stories. But some of the people who've taught me the biggest, most valuable lessons are the ones that are no longer here. Those are the ones who have come along, tried a bit of recovery, failed, picked up again, and are now dead. And I realised that if I try and do things my way, I'm going to fail. So I try and take on board all the advice that's given to me, follow the suggestions, and that way I don't have to be another statistic, because there are too many healthcare professionals that are dying from this disease.
What would you say in terms of your journey through recovery? How has that changed how you practice medicine now? Because you are practicing medicine now, obviously. You did make that comeback. Maybe tell us a bit more about that and really how that's impacted your practice.
So part of my GMC conditions initially were to tell any future employers, because I'd just been sacked, that I had this issue, and people weren't touching me. I was a bit of a pariah. But then the area I'm working in now, Forth Valley in Scotland, had this portfolio GP job, a bit of GP one day, and I could manage that, a bit of prison work and a bit of addictions work. So I was totally honest at the start, and I was like, this is where I was, this is where I am now. I've done the RCGP drug misuse course. I think I can be a valuable asset, turn that negative into a positive. And they took a chance on me. And the guy who employed me, he ended up taking me into his practice so he could keep a close eye on me. He became my workplace supervisor. And I did okay in those jobs. I think I made a difference in the prison. I was a bit of a poacher turned gamekeeper and tried to reduce the amount of abusable medications that were dished out. Because of that, we also reduced the amount of bullying and violence that was going on there. I think I made an impact on the addiction service. But then after a few years, the guy who'd taken me into his practice said, you know what, you've done really well, I'm retiring, do you want to take over the partnership? And that was a big, massive step, but I did that. I'm the GP with a special interest in addictions at the practice. We've managed to massively reduce the amount of Friday afternoon requests for drugs that have gone missing, put boundaries in place. Patients seem to respond well to boundaries if you let them know where the boundaries are. We seem to have a lot more time to deal with other patients now because we're not firefighting the addict patients. Most of my patients know where I've been. I've been sitting in recovery meetings where, like Narcotics Anonymous, Cocaine Anonymous, where some of my patients are. And, sort of I've just been like, you know what, I'm human too. This is what I have to do to stay well. It seems to have had a positive impact. I've had patients come to me and say, I want to see you because I've got this problem and you'll understand. I've also had a couple of patients who've tried to refer me to the GMC because I won't give them the medications that they want. And the GMC are like, let's just push that back. Yeah, he's done his time. So yeah, it's progress, not perfection. I'm not perfect. I never will be. None of us are. But I'm trying to do the best I can with this busy, mad head that I've been given.
I like the idea that people are feeling much more comfortable to come and talk to you because they know they're not going to be judged and they're not going to be frowned upon.
They realise that I'm not going to stigmatise them. Yeah, I'll maybe understand. I'll maybe empathise. Often they don't want to take on the suggestions I give them. And it's like, okay, fair enough. I can show you the door that I walked through, the door that most people seem to walk through to get better. But if you don't want to do it that way, then, sort of we'll do it another way. Then we'll find compromises. I just try not to give them the tools to kill themselves. So I won't prescribe excessive amounts of opiates. I won't prescribe diazepam. I will do my damnedest to keep away from the gabapentinoids if they've got an issue. I'll try and give them what they need, not what they want.
Following on from what you just said, what would you advise your colleagues who've not had your experiences? What could you advise them to do differently when they're engaging with their patients, just in terms of how they're talking to them, how they're interacting, not being judgmental, not stigmatizing them? What tips could you give them on that?
I've got a spiel that I come out with. It's kind of a Barnum statement. I say to the patient, you've probably got low self-esteem. You've probably got low self-confidence. You probably feel judged and criticised by other people, but you're your biggest judge and critic. You probably do other people's thinking for them. I bet they think this about me. How dare they? You probably overthink things, overanalyze and catastrophize. You've got a really, really busy head, and using something, alcohol, drugs, calms it down for a little bit, but then it comes back with a vengeance. And I'm just trying to sort of ID with them. And some people are like, yes. I had one guy who was like, oh my God, can you see inside my head? And some people are like, yeah, some of that, but not all of it. And I'm just trying to get some identification. And once I've got that, the rapport is a bit easier. For people who use cannabis, they're sort of like, I smoke too much cannabis. Is it resin or grass, pollen or cheese, skunk, super skunk, sensimillion, northern lights, black widow? And they're like, how do you know this? And it's all about know thine enemy. Once you know what people might be using, it makes it easier. When I was in the prison, I realised that tramadol was being used for oral sex in some of the sex offender population. And once I realised that, and I refused to be a bankroll for them to carry on, then, sort of I managed to reduce the prescribing massively. It's all about knowing what's going on out there, and then you can maybe act on that knowledge and try and improve the situation one patient at a time. There's a big problem at the moment with ketamine. I'm not sure how to deal with that. But knowing a little about ketamine and how it can cause problems with the bladder, that makes it easier to talk to those patients. It's just about sort of increasing your knowledge about the problems that are going on. And if you have a patient that has an issue, say, tell you what, I'm going to go away and read about this. I'm going to ask a few people about what's going on, and then maybe we can see each other in a week or 2 weeks' time and see where we're at. But while I'm doing that, maybe you can go to some of these recovery type meetings, something anonymous, smart, whatever, and see if you can get some identification of other people who've been there, seen it, done it, and see what they've got to suggest.
Yeah. So tell me about the different recovery meeting options. Anybody who might be listening to this and identifying with some of it, where would you send them to now, today?
No one chooses to end up in a recovery meeting. They end up having to go there because they've got no choice. Addiction is like an elevator that's constantly going down, and you can get off at any point, but most people don't get off until rock bottom. The first place that people recommended was AA, Alcoholics Anonymous. They've got this big book that was written in the 1930s. They go on about God, a higher power, something bigger than you. I don't believe in a religious version of that, but I do believe I had the gift of desperation, and I needed a group of drunks, a group of drug addicts, a group of doctors who had been there before to try and help me. Then there's Narcotics Anonymous. It's mostly opiates that people would go there. Sometimes it's other drugs, and sometimes it's alcoholics. Yeah, they're quite nice meetings. I love Cocaine Anonymous. That's for any mood or mind-altering drug and behaviours. I go to some of those meetings. I was at one last night. Really quite funky crowd. I like them. There's also things like Gamblers Anonymous, Sex and Love Addicts Anonymous, Overeaters Anonymous. There's a Nicotine Anonymous. For family members of people who are going through this, there's Al-Anon, Alateen. For doctors, there's British Doctors and Dentists Group. There are also sort of lifestyle recovery-based programs such as Smart Recovery, where they look at the 4 different aspects of life. We've got a Forth Valley recovery community up here where they have like an Olympics every year and do cool and funky stuff. When you're an addict, you end up in isolation. It's just you. Yeah, you're pushing your family and your friends apart. But getting into recovery is all about networking, making connections. When my mum killed herself and I was in recovery, that was a very stressful time, and I could have gone back to my old default way of using. But I went to a meeting as soon as I could, told my boss I couldn't be at work anymore, went to a meeting, and there was someone there who had been through something similar, and we got to share that, and I didn't have to go back to my old coping mechanisms. So it's all about talking to people who've had similar lived experience.
What an amazing difference to have experienced something so awful as that when you're in recovery, and to not have gone back to your previous coping mechanisms. You know, what a test.
I hope I never find out about what it's like to lose a child or something so severe like that. But I don't think I could go back to that old way of doing things. People say that you don't go back to the old insidious, slow progress of it all. You just go back to the madness where you left it. And I don't fancy that anymore. Addiction and recovery from addiction has opened so many doors to me. Those doors won't be available if I pick up. And there's just too much going on. I've been nominated for an RCGP award. I may not get it. We'll see. I'm going to Paris to talk to the young doctors of Europe in June because of all this stuff. This has given me some immense opportunities that I would never have had if I hadn't been through all that lived experience. What doesn't kill you only makes you stronger.
So what are the best things in your life now that you're on the other side of it?
I've got 2 recovery children, and if I'd have managed to take my own life all those years ago, I wouldn't have had that. They wouldn't be in the world. I went to Taylor Swift with my 11-year-old at the time. She's 13 now. One of the most joyous days of my life, yeah? It was fabulous. Previously, I might have judged it and criticised it. This, I just went along and just revelled in it. I still play football at the age of 56. I love that. I'm slowing down. I'm in goal most of the time. But I love stopping other people from scoring. It's a buzz, yeah? It's a free buzz. It's the endorphin. I love talking to people who have similar life experiences. I talk to medical students every year at Glasgow University, tell them my story. And every year, invariably, someone comes up and they've got a friend or a peer or themselves that have had similar issues. And it's fabulous, just telling people where you've been, where you are now, trying to sort of like help others. And that's kind of like doing service. We go into medicine to do service, to help people. But I've got a foot in both camps, and I can say, well, sort of this is where I was at. And if I'm helping people, I'm less selfish and self-centered and takey, which is where I used to be. I think I've changed over that time. So what are the other benefits? Change. I kind of like who I am now rather than feeling sick and tired and disappointed with who I'm at.
I've really enjoyed talking to you. It's been really inspiring, and that's a little bit cliched and you possibly hear it a lot. For our listeners, we'll link to the sources of support that you mentioned in our show notes, and our listeners can also go and claim their CPD credits for listening to this podcast at our website, mimslearning.co.uk. So thank you again for joining us, Michael. It's been a really, really moving interview, and I've really enjoyed speaking to you.
Hugs, not drugs.
Well, that's it for this week. Thanks for listening, and thanks to Rhiannon and Michael for this episode. I'll be back next week when we're back with our regular news review after a short summer break from that. So please do join me then, because there'll be lots to catch up on. In the meantime, don't forget you can keep up to date with all the latest news and access lots of other resources on our website at GPonline.com.